Abnormal uterine bleeding are a whole range of symptoms that ranges from postcoital bleeding, that is bleeding after sexual intercourse, bleeding in between periods, which is called intermenstrual bleeding, and bleeding after menopause, which is postmenopausal bleeding. Intermenstrual bleeding is mainly the bleeding in between periods, and that is very common among younger group of women. Being on the pill can lead to bleeding in between. Dysfunctional uterine bleeding, which is heavy menstrual bleeding and other things, could be associated with bleeding in between. And sometimes structural problems like having fibroids or having polyps, adenomyosis, or any other abnormalities in the womb itself can lead to bleeding in between. Remotely, endometrial cancer can also cause bleeding in between. So it could range from anything benign conditions to something very sinister. And we have to always look at age group. Younger women very rarely have endometrial cancer. So common things like benign abnormalities, which could very readily be treated, is what we are looking for.